Seniors, I need your attention. Your kidneys could be dying in silence, without pain, without warning, until it's almost too late. As a nephrologist, I'm begging you to listen carefully. Over 90% of seniors with kidney disease don't even realize it until the damage is advanced and irreversible. I've seen hundreds of patients over 60 walk into my clinic, feeling fine, only to find their kidneys were already shutting down. They missed the silent alarms their bodies were sending. You don't have to make the same mistake. According to the CDC, 1 in 3 adults are at risk of kidney disease. And seniors? You're at the highest risk. Time isn't on your side. But here's the truth: catch the signs early, and you can slow, even stop, the damage. What if you could recognize the whispers before they became screams? Let's dive in. These 7 signs could save your life. Number 1, swelling in ankles, feet, hands, edema. Seniors, let's talk about one of the very first, and often ignored, signs that your kidneys are in trouble: swelling in the ankles, feet, and hands. Medically, we call this edema. It's not just normal aging or water retention, it could be your body's silent cry for help. Here's what's happening inside your body. Healthy kidneys maintain a precise balance of fluids, electrolytes, and proteins. But when your kidneys start to fail, they lose the ability to properly remove excess fluids. Instead of being filtered out in your urine, that fluid leaks into your tissues, causing visible swelling. Even more alarming, kidney damage often causes albumin, a vital blood protein, to leak into the urine. When albumin levels drop in your blood, it creates a pressure imbalance, allowing even more fluid to seep into surrounding tissues. What should you watch for? Your shoes may suddenly feel tighter, especially by evening. Rings that used to slide on easily now feel snug. Puffiness around your ankles, noticeable after long periods of sitting or standing. These are not harmless changes. Left unaddressed, this fluid buildup can escalate to severe swelling, putting extra strain on your heart and lungs, increasing your risk of congestive heart failure, a dangerous and often fatal complication. Most seniors dismiss swelling as just old age or too much salt, delaying diagnosis until it's too late. Don't make that mistake. If you notice persistent swelling, especially in the lower extremities, don't ignore it. Get your kidney function tested immediately. A simple blood test for creatinine and a urine test for protein can reveal early kidney damage before it spirals out of control. Your kidneys are whispering. Are you listening? Number 2, changes in urination, frequency, color, foaminess, blood. Seniors, one of the most critical and telling signs of kidney dysfunction is a change in your urination patterns. Most people don't realize it, but your urine is a direct report card on your kidney health, and changes are often the first red flag. Here's what's happening inside. Your kidneys are responsible for filtering your blood, removing waste, and producing urine. When they begin to fail, these processes become compromised. Subtle, but serious, changes begin to appear. What should you be watching for? Frequent nighttime urination, medically called nocturia. Waking up more than once or twice per night to urinate could indicate your kidneys are struggling to concentrate urine. Dark brown or tea-colored urine, a possible sign of blood in the urine, indicating damaged kidney filters. Foamy or bubbly urine, often dismissed as harmless, but persistent foam could signal proteinuria, the leakage of protein into the urine. Now, why is this dangerous? Proteins, like albumin, are large molecules. Under normal circumstances, they stay in the bloodstream. If they're leaking into your urine, it means your kidney's filtering units, the glomeruli, are damaged. This is not a small problem. Protein loss not only accelerates kidney damage but also increases your risk of full renal failure, heart disease, and even early death. These urine changes may seem minor, easy to ignore. But they are your body's early warning system. Many seniors overlook them until the disease progresses to a point where dialysis or transplantation becomes the only option. Check your urine regularly. A change in color, frequency, or the appearance of foam is not normal. Urine is your daily health report, and it's whispering to you. The sooner you listen, the better chance you have to preserve your kidneys and your life. Number 3, persistent fatigue and weakness. Seniors, it's easy to blame tiredness on just getting older. But when fatigue becomes constant, when rest doesn't restore your energy, it's time to think deeper. Persistent fatigue and unexplained weakness are silent hallmarks of kidney decline, and too often, they're overlooked until it's too late. Here's the biological truth. Failing kidneys can no longer efficiently remove waste products like urea from your bloodstream. These toxins build up, quietly, causing you to feel exhausted, heavy, and drained. But there's more. Your kidneys also produce a critical hormone called erythropoietin, EPO. EPO signals your bone marrow to make red blood cells, the cells that carry oxygen to your tissues. When kidneys fail, EPO production plummets. The result? Anemia, a dangerous condition where your blood can't carry enough oxygen. Symptoms you might notice: constant tiredness, even after a full night's sleep. Weakness, daily tasks feel harder, you tire easily. Shortness of breath, climbing stairs or even walking short distances leaves you gasping. If left ignored, anemia forces your heart to work harder to deliver oxygen, increasing your risk of heart enlargement, a serious, often fatal complication. A 68-year-old patient came in, complaining of fatigue she thought was normal aging. She struggled with basic chores, napped frequently, and avoided her evening walks. Routine blood work revealed stage 3 chronic kidney disease and dangerous anemia. If she had ignored it longer, she would have faced heart failure. Don't normalize exhaustion. If you're tired more than usual, if you feel weak without explanation, get your kidneys checked. Fatigue is not just a symptom of old age. Sometimes, it's your kidneys crying out for help, in silence. Number 4, trouble concentrating, memory issues, uremic encephalopathy. Seniors, memory slips and mental fog are not always a normal part of aging. Sometimes, they are early warnings that something deeper, and far more dangerous, is happening inside your body. When your kidneys begin to fail, they lose their ability to filter waste products effectively. As a result, toxins build up in the bloodstream. These aren't harmless, they circulate throughout your body, and most concerningly, they reach your brain. This toxic overload impairs your brain's ability to function, a condition called uremic encephalopathy. What might you notice? Forgetting recent conversations or appointments. Difficulty performing simple calculations, things that used to be easy now feel complicated. Mental fog, feeling dazed, distracted, or unable to focus on a task. You may feel like you're losing sharpness, not slowly over years, but noticeably over weeks or months. Some seniors even describe it as being in a cloud or having their brain slow down. If left ignored, this cognitive decline can quickly spiral into serious dangers, falls, as balance and judgment worsen. Medication mistakes, forgotten doses or double dosing. Dementia-like symptoms, sometimes leading to misdiagnosis and unnecessary treatments. When seniors, or their families, notice sudden memory changes or confusion, they often rush to a neurologist. But sometimes, the problem isn't in the brain, it's in the kidneys. If you experience new or worsening memory problems, don't ignore it or dismiss it as senior moments. Get a kidney function test immediately. Checking your creatinine and GFR could reveal that the issue isn't age-related, it's your kidneys struggling to protect not just your body, but also your mind. your brain and kidneys are more connected than you realize. Number 5. Persistent itching, pruritus. Seniors, let's talk about a symptom few connect to kidney disease, persistent itching, medically known as pruritus. It's not just dry skin. It's not just a reaction to the weather or aging. It could be a dangerous sign that your kidneys are struggling, silently. Here's the reality: as kidneys fail, they can no longer properly remove phosphates and other toxins from your bloodstream. These substances accumulate under the skin, irritating nerve endings and triggering an itch that's relentless, deep, burning, and impossible to ignore. What should you watch for? Intense itching, often worse at night, robbing you of sleep. No visible rash, despite the overwhelming urge to scratch. No relief, lotions, creams, or antihistamines do little to calm it. This isn't surface-level irritation. It's a symptom of toxin buildup inside your body, and a clear sign that your kidneys are no longer functioning effectively. The science behind it: high phosphate levels are common in the later stages of kidney disease. These phosphates deposit into the skin and irritate the small nerve fibers, leading to the uncontrollable urge to scratch. Persistent itching can cause broken skin, leading to infections, open wounds, and bleeding. For seniors, this is particularly dangerous because it increases the risk of systemic infections, which can be life-threatening. I've seen patients come in covered in scratches, exhausted from lack of sleep, unaware that their kidneys were at the heart of the problem. If the itching feels deep, not superficial, and doesn't improve with ordinary skin care, get your kidneys checked. A simple blood test checking your phosphate and creatinine levels can reveal the hidden cause. Persistent, unexplained itching is more than an annoyance, it's your body raising a red flag. Don't ignore it. Number 6. Shortness of breath, fluid in lungs. Seniors, if you're finding it harder to catch your breath lately, even during simple activities like walking across the room, don't assume it's just age, weight, or weak lungs. Shortness of breath can be a powerful early sign that your kidneys are in serious trouble. Here's what's happening inside: your kidneys are designed to filter excess fluid from your body. But when they begin to fail, that fluid doesn't get properly eliminated. Instead, it accumulates, and one of the most dangerous places it builds up is inside your lungs, a condition known as pulmonary edema. Symptoms you must not ignore: breathlessness during mild activity, even simple housework can leave you gasping. Waking up gasping for air at night, this is called paroxysmal nocturnal dyspnea, and it's a classic warning sign. Many seniors mistake this for a heart or lung problem, but the hidden culprit may be failing kidneys allowing fluid to drown the lungs from within. Pulmonary edema can escalate rapidly, leading to respiratory failure, a life-threatening condition that often requires emergency dialysis to remove the fluid and relieve the lungs. Waiting too long can mean the difference between manageable kidney disease and a full-blown crisis. If you experience new or unexplained shortness of breath, especially when lying flat or waking suddenly gasping, don't wait. Even if you have no history of heart disease or lung problems, think kidneys. A simple chest X-ray combined with kidney function tests can quickly reveal fluid overload and early kidney dysfunction. Remember, your lungs depend on healthy kidneys to stay clear. When they suffer, your whole body suffers. Don't dismiss breathlessness, it's one of the loudest silent cries for help your kidneys will ever send. Number 7. Metallic taste in mouth/ammonia breath, uremia. Seniors, your body often speaks to you in small, unusual ways, if you know how to listen. One of the more subtle but critical signs of kidney trouble is a metallic taste in your mouth or breath that smells like ammonia, an unmistakable warning that waste is building up in your blood. Here's what's happening: when kidneys are healthy, they efficiently filter waste products like urea from the bloodstream. But in kidney failure, these waste products accumulate, a condition called uremia, and they alter both your sense of taste and smell. Symptoms to watch for: food tastes metallic, bitter, or just off. Ammonia-like breath odor, often compared to the smell of urine or cleaning chemicals. Loss of appetite, leading to noticeable weight loss. These are not just minor annoyances. When food starts to taste unpleasant or your breath smells abnormal, it's a direct reflection of toxins circulating in your blood, toxins your kidneys are no longer able to clear. If ignored, persistent uremia can cause malnutrition and muscle wasting, rapidly accelerating physical decline. Seniors who lose appetite often lose not just weight, but also crucial muscle mass, which can lead to weakness, falls, and loss of independence. Malnutrition further weakens the body's defenses, leaving you vulnerable to infections and severe health complications. If you or a loved one notice sudden food aversions, a strange metallic taste, or bad breath without any dental issues, don't ignore it. Get a kidney function test. These symptoms may seem harmless, but they are the body's urgent signal that your internal waste management system, your kidneys, is failing. Remember, when food loses its flavor and breath loses its freshness, it's time to check your kidneys before it's too late. When to see a nephrologist. Seniors, knowing when to see a nephrologist can make the difference between protecting your kidneys and facing irreversible damage. You should see a nephrologist immediately if you have diabetes, high blood pressure, or a family history of kidney disease. These are the top risk factors. Your blood tests show a low GFR, less than 60, indicating reduced kidney function. Your serum creatinine levels are rising, a direct signal that your kidneys are struggling. You notice any of the 7 warning signs we discussed today, even one is reason enough to act. Don't wait for symptoms to worsen. Early detection can delay or prevent kidney failure, but only if you act quickly. When you visit your doctor or nephrologist, ask for these crucial tests: GFR, glomerular filtration rate, to measure how well your kidneys filter waste. Serum creatinine, to assess waste levels in your blood. Urine ACR, albumin-creatinine ratio, to detect early protein leakage. Electrolyte levels, especially potassium and phosphate, to catch dangerous imbalances early. Your kidneys work silently every day. Don't wait until they cry out. Listen now, while there's still time to protect them. Seniors, your kidneys are silent fighters. They work every day, filtering waste, balancing fluids, without complaint. But even the strongest fighters need help. When your kidneys begin to struggle, they don't scream. They whisper. And if you listen closely, you can hear them through swelling, fatigue, shortness of breath, changes in urination, and more. Remember, kidney disease doesn't happen overnight. It's a slow, silent process, but it can be stopped if caught early. You deserve to live your golden years healthy, active, and independent. Don't wait for a crisis. Act early. Save your kidneys, save your life. If this video helped you, share it with your family and friends. It might just save a life. Comment below if you or someone you know has noticed any of these warning signs. Like, subscribe, and hit the bell for more senior health tips that could protect your future. Stay strong. Stay healthy. Stay informed.